And our top focus this hour, developments that are taking place as far as COVID is concerned, the uptick that has been reported day by day, minute by minute. India has reported a total of 3,395 active COVID-19 cases in the country. The Ministry of Health and Family Welfare has updated the number of cases, with Kerala reporting the highest surge in with 1,336 active cases. A total of 685 cases have been reported in a single day. Kerala has been followed by Maharashtra with 485 active cases, and Delhi with a total of 375 patients with active cases of COVID-19. 4 deaths have been reported in the country in the past 24 hours, with 1 death each from Delhi, Uttar Pradesh, Karnataka and Kerala due to COVID-19. However, the government has maintained the most of these COVID-19 cases are mild infections and not fatal. It should be noted that there were 257 active COVID cases in the country on May 22nd. The figure rose to 1,010 by May 26th and reached 3,395. Citizens are advised to follow precautionary measures and safety protocol. My colleague Arzu is with us on the broadcast to give us more on this. Arzu, of course, day by day, the COVID, the number of active patients, those numbers are rising day by day. We just spoke about 22nd May, where the number was in hundreds, but now, of course, we're seeing a big jump in the numbers. What more can you tell us?
Well, definitely, COVID-19 cases are surging in India, with the total number of cases spiking to 3,207 and also 20 deaths reported. And if we say the state-wise also, there has been a lot of increase in the number of cases. And in fact, if we talk about the death data also, the Maharashtra is on the top with 6 deaths, and also Karnataka 3 deaths, and Kerala, Uttar Pradesh and Rajasthan reporting 2 deaths. In fact, Delhi has now reported 1 death, and there are a lot of states like Punjab, Madhya Pradesh, Tamil Nadu and Gujarat reporting 1 death due to the COVID-19. And in terms of the active cases also, Kerala topped the list with 1,147 cases, followed by Maharashtra with 681 cases. So the rising cases have prompted the Karnataka government to take the precautionary measures, advising the patient not to send their children to schools, or also if they have symptoms like cold, cough and fever, to prevent themselves from going to the the most populated places. And also the health department has confirmed that the new deaths in the several states. So if we see Delhi also, Delhi is also reporting a lot of cases of COVID-19 cases. There has been a surge since last week, and also the latest official data that is available showcase the number of COVID-19 cases in Delhi are around 375 active cases. Also 1 death reported of a 60-year-old woman. So the city has seen the surge in COVID-19 cases, and after May 23rd, the advisory has also been issued in the government and also the private hospitals to ensure the proper medication and also the proper bed facilities and oxygen facilities to every patients who are coming to the hospitals. Yes, Sabri.
Absolutely, Arzu. Thank you so much for giving us an overview on that front. In fact, joining us on the broadcast is Dr. C Mishra, former Director AIIMS. Sir, very good morning to you, and thank you so much for taking our time and speaking to us on NewsX. Just talking about the numbers from 22nd May now, of course, we're seeing that the numbers have now risen from hundreds to thousands, and deaths are also being reported. We've been receiving a lot of phone calls here at NewsX asking what the situation is like and what one must do. So we want you to answer that question, sir.
Thank you so much for keeping this discussion this morning on a Sunday. What I would say that yes, there is number has increased, so must be the testing for COVID or non-COVID viral infections. And this is what we discussed last week also, that there are these new Omicron subvariants have been detected, and which includes LF.7, XFG, JN.1, NB.1.8.1, and basically they are easily transmissible and and there is no cause for panic as of now, according both to ICMR as well as WHO. Variants under monitoring, what WHO says, rather than various variants of concern. So we should be quite reassured that if we take universal preventive measures ourselves, those who are infected and those who are not infected, both. So should we be worried? Basically, while the new subvariants may be more transmissible than previous strains, but they have not demonstrated an increase in severity of the COVID illness. And their rapid spread has been noted in other countries also, like China, Taiwan, Hong Kong, Australia, Singapore,
Yes.
etc. And so what most experts believe and advocate that maybe you can again think of vaccination for protection, but as of now, the booster may not help. And they also recommend wearing masks in crowded or poorly ventilated spaces, particularly like going into a lift with a lot of crowd, and also in buses and in local trains, the metro. I think that is what something we need to do in hospitals. We must take all the measures, precautions, particularly those with pre-existing health conditions, which lowers immunity. And given the trend showing this increased transmissibility but low hospitalization rates, the focus should remain on staying vigilant, all of us, and without succumbing to anxiety or panic. And the symptoms are no different than any other viral illness. Those are fever, body ache, headache, running nose. Maybe there some people may lose smell, some people may have loose motions. So what I call 3H: home care, hydrotherapy in case the fever goes 103, 104, and hydration. Keep yourself well hydrated, well nourished, rest at home, bring down the temperature by paracetamol and the cold sponging in case it doesn't come down with paracetamol, which happens many a times. And most people have been recovering. Of course, the number of cases in your story has already been told, which states are having more surge than other states. But I think this increase is largely due to increased testing rather than, because the viral spikes do go in winters as well as in summer months. And when these strains, new strains emerging in Omicron, which is easily transmissible and it's an airborne disease, so all those preventive measures which we have been discussing all last 5 years should be followed by most people if they want to save themselves from the agony of having the COVID fever. This is what I would say.
Right.
There's no need for panic. Just be a little bit concerned so that you can prevent it, and you don't go in crowded places. You don't make travel plans if they are not really mandatory or necessary. So all these things put together, I think this spike, this surge will go up and then it will come down very rapidly.
Right, so absolutely. Now, there is another question that people keep on asking. They say that there are a slew of things that happen. You may have a runny nose, loose motions, as you were just talking about. The question is, when should one then go and get themselves tested? Because a lot of people don't want to go to hospitals as well.
Yeah, I would recommend don't run after the testing. It doesn't matter whether it's COVID or non-COVID, unless you feel breathless or your oxygen saturation goes down. And most of us now these days have those pulse oximeters which people bought during COVID pandemic. So it is not a pandemic situation. That's number one. Booster dose may not help immediately to combat this surge, and testing is up to the individual. If you want to test, you test. Otherwise, it's academic interest only, whether it's a COVID or non-COVID, it will add to the numbers. That is all what it is going to do. And most of the deaths which have been reported recently, 4 or more, they are not directly related to COVID illness primarily. Basically, these people have been suffering from other illnesses, serious illnesses, and also contracted viral fever, which might be COVID, which might be non-COVID. So this is something people have to understand. So not to worry about it, but be a little bit cautious so that you take the adequate preventive measures when you are going in crowded places, when you are traveling metro, bus or train, I think, or airports or any crowded places, marketplace or anywhere. And also we are taking precautions ourselves in the hospital by putting on mask when we are seeing a patient and their families, when they visit us in outpatients. So not to worry, most people have been recovering without hospitalization. People should not panic that if they have tested positive for COVID, something will be very serious. It is not going to be like that. So just take it easy and rest at home, bring down your temperature, keep yourself hydrated and nourished, and also home care with paracetamol and whatever your family can support. Also isolate at home if possible. Not everyone has that luxury of getting isolated in places, but those who have that luxury, they can isolate themselves from other family members. So do not sit on the same dining table, do not sit and watch television, the same television. So I think if people take these measures, precautions, we can contain this number going up.
Right.
Testing, leave it to individuals whether they would like to have it done or they don't want to have it done, because the viral illness will settle in 5 to 7 days.
Right, sir, absolutely.